I enjoy seeing other people happy. I enjoy helping people. I was always a loner growing up, but I'm a people person now that I've grown up a little older. Favorite thing I like to do is going and delivering meals to the seniors. These people do not get out. Sometimes they don't see anybody but me all week long. And each one's always willing to tell me a little bit about what happened during their week. It came on to me all of a sudden. I had a lot of pain in my leg, and then it went up my back. It didn't bother me so much when I was walking around, but then at night when I would lay down, some nights I would cry all night long. It was something that I can't even express the pain that I had. I was told I had scoliosis. It kept me at home. I did not want to go. Even to family functions, I wouldn't go. I would have an excuse. It left me very lonely. It got to the point I didn't know family members because I didn't get to see them. To the point, well, why do I want to go with them? Why, they don't know me anymore. Or I didn't want them to know that I was suffering. So I kept it very quiet within my own family. Maybe I could go 2 or 3 hours and then I would have to have a pain pill. If I would do a lot of walking, then I would come home and I would have to have a pain pill. And walking was something that I enjoyed doing. Do I give up my walking or do I want to be taking these pills? Well, then it got to where I thought I was taking too many pills.
When she first presented to her provider and she had very sharp shooting pain, they had given her some opioids. 2 years later, when she still had sharp shooting pains, they needed to try to find a better treatment regimen. So when she came to see me, her provider had just stopped using the opioids and had transitioned her over to a neuropathic agent. I work for medication therapy, disease management, and chronic pain. So as a clinical pharmacist, I work under referrals from Geisinger primary care, or I can work under specialty to be able to assist patients to optimize their medications. There's a lot of good medications out there, and often you'll hear somebody say, this medication didn't work for me, or that medication didn't work for me. And it's often that they're unfortunately not using them correctly in the right dose or the right schedule. She was on a good medication, but she had inadvertently self-changed it, thinking it would be better to take it when she had her higher points of pain, where she needed to be taking that all the time to keep the pain from getting high. So we had a really great talk about how the new medication should work.
She got me into a system whereby by the time the pain would start, I was taking the next pill. I started out with a real low, and then the next dose that I would take, like around lunchtime, would be an increase over the first one. And then the one that I would take at night was almost double of what I would take in the afternoon, which would get me through the whole night. It's working. I feel free. I feel like I can go through an every day and not have the pain. And I'm forever grateful for her.
When she came in here and she told me she was sleeping through the night, she was walking, she was doing her volunteer work, she was enjoying her life, I told her, I get to discharge you today, and that is the happiest thing that I can do, to tell a chronic pain patient that I don't need to see them any longer.
When I look back, I don't know, I can't imagine even me sitting at home now because of what I want to do now. I can't imagine what my life would have been like. I don't have to be afraid of going for walks with my grandchildren. They walk a little faster, but Grandma can keep up. I don't want to sit back and not tell people how I got helped, because it is a new life for me. If somebody is suffering and I can help them have a new life, that's what I want to do.